Okay. All right, well, good morning again, everyone. Today is Thursday, June the 5th, 2025, and we've convened the Board of Health for the New York City Department of Health and Mental Hygiene. The time is 10:09 a.m., and I will now call this meeting to order. I'll conduct a roll call. Are the following members present? Dr. Angelo Akista?
Present.
Dr. Maida Galvez?
Present.
Dr. Mitch Katz?
Present.
Dr. Simona Kwan?
Present.
Gail Nyowith?
Present.
Thank you very much. I'm going to start with some brief updates to the board just because it is a time where public health is moving fast and furious. And these updates, I think, are quite relevant to the agenda that we have for the meeting today. So with that, we can start with the next slide. I know all of you as fierce public health advocates and experts have been watching very closely several of the federal actions that impact public health. There have been over 150 executive orders so far. Just this past Friday night, the president's FY26 budget was released, which is a document where the president expresses his priorities. It's not itself immediately going to be implemented, but certainly gives us a sense of the direction the White House wants to go in. We've also been following the reduction in force actions, retirement buyouts, and the restructuring of HHS and other agencies, all of which impact public health nationally and here in New York City. And then we've also, of course, been following and acting very closely to protect the current grant commitments that we have from the federal government. We unfortunately received news in March of a rescission of over $100 million in federal funding that we had for COVID, disease surveillance, community engagement, and other activities. There is a preliminary injunction in place to preserve that $100 million in funding that we have in the New York City Health Department, and we are following very closely how that case will continue to evolve in the courts. I'm sure you've all also been following very closely significant changes to the widely accepted, previously standardized vaccine approval process, particularly with attention to the COVID-19 vaccine that's been in the news, with the FDA and HHS making somewhat conflicting announcements recently about COVID vaccine eligibility and approvals. There's also been initiatives to deregulate several different public health functions. And then also just a couple of weeks ago, the Make America Healthy Again Commission released its initial report and is now working on a series of recommendations to follow that report. So it's been a very, very busy time in public health. And I do want to note that about 20,000 staff are no longer with HHS because of a combination of the reduction in force and buyouts. That being said, we can move to the next slide. I do want to highlight really briefly, again, the president's budget that was released this past Friday night, May 30th. This budget is really a negotiation tool for the White House as it engages with Congress, but this budget does call for, again, significant reorganization of HHS, about a 50% cut to the budget of the CDC, similar levels of cuts to the NIH and FDA budgets, all of which are federal agencies that we in the New York City Health Department interact with very regularly and work with very closely. There also has been a reorganization proposed of SAMHSA, which we also work with for our substance use and mental health work, and that agency is proposed to be rolled into the new Administration for Healthy America, although we again don't have any information yet about potential implementation or timeline of all of that work. This is the beginning of the process in many ways. Congress will still need to go through the extensive process of budgeting and appropriations that will determine the final budget. And of course, we will be watching very closely as those negotiations continue, with a special eye to the impacts on HHS, who we interact with very closely. Wrapped within this, of course, also are what you've been hearing about in the news with Medicaid potential cuts to Medicaid, potential cuts to SNAP, and again, potential cuts to particularly CDC chronic disease funding and HIV prevention funding, amongst a number of other meaningful areas that are very important to us in the New York City Health Department. So you can move to the next slide. I do want to highlight how important we think it is for us to also focus on data protections right now. This is a significant area of focus for us in our planning in the New York City Health Department. We do consider data to be one of our superpowers here in the agency. We both collect and summarize and release publicly significant amounts of citywide population level data that describes the disease trends across our city, describes the impact of various interventions and programs and policies, and measures progress against those interventions. And we again make much of our data publicly, freely available for researchers, for healthcare organizations, and for other partners to use. However, we have, of course, been taking note of some of the changes at the federal level around privacy of data, protections around data, and other potential concerns. You may have followed some of the reporting about the IRS and Social Security sharing data in ways that have not ever previously been done. From our perspective at the Health Department, we want to make sure that we are protecting the data of New Yorkers and all of our residents to a level of privacy that is really required at all times, not necessarily unique to this time. And in order to do that, we've been reviewing all of the ways that we collect data, how we analyze that data, and how we share it, and who we share it with. So that has been a really important process for us as we adapt to the new federal administration. And we'll be talking more about data privacy and data protections with one of the proposed amendments that we'll be discussing and voting on during the board meeting today. On the next slide, two really important programmatic updates that I do want to share. Our inaugural Office of Healthcare Accountability report was released just a few months ago. This report was required for us to develop and submit and publish by Local Law 78 that was passed back in 2022. This report really describes a number of things around healthcare and hospital pricing practices. The key findings that I want to highlight are that we found very large price variations by hospital system and procedure. We also found that outpatient costs are really driving the city's healthcare expenditures for all city employees. And about half of healthcare spending is concentrated in a small number of health systems. There's much more in the report. The report is 263 pages. I would encourage everyone to take a look at it. And there's a lot more to discuss with that report as well, including the fact that very soon we'll be publishing an online, freely accessible and available public-facing website that also allows for price shopping across healthcare institutions in the city. And then on the next slide, welcome. On the next slide, I just also want to highlight our Health of Immigrants in New York City report that was also just released a few weeks ago. This report is the first time we've done a report like this in about 20 years. It was an 18-month process to develop and publish this report. It presents data to help stakeholders, community-based organizations, healthcare organizations all across the city to understand the health status and needs of immigrant New Yorkers. Immigrant New Yorkers are 1 in 3 New Yorkers, and 47% of the physicians and technicians that work in our healthcare system in New York City are immigrants. There's much more than that in the report, and I encourage everyone to take a look at that. And then finally, in my last slide of the update on the next slide, I also want to just highlight again our commitment to immigrant New Yorkers. This is the open letter that we co-authored with Dr. Katz and the Commissioner of the Mayor's Office of Immigrant Affairs, Manny Castro, to really emphasize yet again that our commitment is to access to care for all New Yorkers, no matter their immigration status, where they come from, the language they speak, their race or ethnicity, or anything else, or ability to pay. And to highlight that our commitment is to ensure the privacy and protection of those New Yorkers who are seeking care, no matter any of those things. So again, every New Yorker, without exception, that is who we care about. So with that, I think we can move into the formal agenda. And before I do that, I think I should note for the record that Dr. Michael Lindsay has joined us and is here and present. Thank you, Dr. Lindsay.
Thank you.
So I'd like to go ahead and move forward with reviewing and approving the minutes from our March 19th, 2025 meeting. Are there any corrections to the minutes from March 19th, 2025? Okay, if there are no corrections to the minutes from March 19th, I will motion that we approve the minutes as distributed. Let the record, could I ask for a motion?
So moved.
Let the record reflect that Gail Nyawith has motioned first. Could I have a second?
Second.
Let the record reflect that Dr. Galvez has seconded. I'll now take a vote from each member. Dr. Akista? Thumbs up. Okay. Dr. Katz? Thank you. Dr. Kwan?
Approved.
And Dr. Lindsay?
Approve.
Okay, great. So with a unanimous vote in favor of the motion, the minutes of March 19th are adopted. Moving forward, we now have some time to talk about a proposed Board of Health statement regarding the department's continued work. This relates certainly to the federal updates that I just described. It also relates to the fact that we have to continue to focus our work and our commitment on the future of health for New York City, no matter what changes we have to adapt to and deal with at the federal level. So that being considered, we wanted to have the opportunity with the leadership of the Board of Health to restate our focus, our mission, and our work and our commitment to the health of New Yorkers in this time. So on the next slide with that context, our proposed Board of Health statement from the members of the Board of Health reiterates our historic accomplishments and our continued efforts to protect the health of New Yorkers. There are several affirmative statements that re-emphasize our focus and our commitment to promoting the health of New Yorkers, to affirming the duties of the Board of Health and the role of elected and appointed officials to prevent harmful changes to public health and behavioral health. And then this statement also reminds us and directs us to monitor and assess the impact of federal changes to public health and behavioral health, share remedies with this Board of Health, continue implementation of science-based health guidance, combating misinformation, and engaging in regional collaborations as well to promote public health. So we'd like to go ahead and read the statement, which is quite brief, and then we'll have some time for discussion. So I'll ask Gretchen Van Wy to come forward, who's going to read the whereas statements that are a part of our Board of Health statement.
Good morning. Good morning. Thank you. Whereas the New York City Department of Health and Mental Hygiene, or the New York City Health Department, is required by law to protect and promote the health and well-being of everyone who lives in, works in, or visits New York City. Whereas the New York City Health Department has demonstrated its public health expertise over 2 centuries of interventions and programming that have resulted in improving New York City's health and life expectancy. Whereas since its establishment more than 220 years ago to combat infectious and deadly yellow fever, the New York City Health Department has propelled public health revolution with its life-saving services, facilitating the availability of fresh water in the 1820s, battling cholera in the 1850s, inspecting milk in the 1870s, fighting diphtheria in the 1890s, and vaccinating hundreds of thousands against smallpox in 1900, among other cutting-edge health reforms. Whereas the New York City Health Department has scaled and modernized its capabilities to protect and improve the millions of lives it now serves. It vaccinated 6.7 million people against smallpox in a single month in 1947, pioneered the protection of children from lead poisoning in 1960, curtailed a tuberculosis epidemic in the 1990s, managed measles outbreaks in 2018 and 19, and led New York City through the COVID pandemic, including vaccination efforts resulting in almost 90% of all New Yorkers receiving at least 1 protective shot. Whereas the New York City Health Department stands at the forefront of ensuring that all New Yorkers, regardless of immigration status, ability to pay, or ability to speak English, have access to the health information and services they need to live and thrive. In 1921, the New York City Health Department opened the first district health center in Harlem to address local health needs of community members. Centers in the Bronx and Brooklyn followed. 3 neighborhood health action centers in East Harlem, the South Bronx, and Central Brooklyn currently serve New Yorkers marginalized by decades of disinvestment and deserving of equitable and just service delivery. The Race to Justice program reform effort, which was launched in 2015, teaches staff how to better address racial health inequities and improve health outcomes for all New Yorkers. Whereas the New York City Health Department has long advocated for and supported mental and behavioral health needs of New Yorkers, including by opening the first ever supportive housing programs in the nation in 1980, standing up in collaboration with state and local partners, the first legally authorized syringe exchange program in the state in 1993, and continuing to innovate comprehensive behavioral and mental health services for New Yorkers through its CARE Community Action Mental Health Plan. Whereas this year, our nation has seen a rapid and extreme federal action to undermine public health, including the defunding and dismissal of 10,000 full-time employees of the nation's Department of Health and Human Services, severance of access to basic medical care, vaccines, medicines, food, clean water, and humanitarian assistance to millions of people through the shuttering of USAID, and curtailment of information sharing, outbreak preparedness and response, and investments in global public health infrastructure through a retreat from the World Health Organization. Whereas from HIV to Zika to Ebola to the COVID-19 pandemic and Mpox outbreaks, it is evident that global public health challenges become local in New York City. Whereas in late March 2025, without notice, HHS terminated billions of critical public health funding across the country that supports disease surveillance and detection, public health laboratory capacity, vaccination activities, and community outreach and education, including over $100 million to the New York City Health Department. Whereas the New York City Health Department relies on federal funding for 20% of its annual budget, or around $600 million, to maintain the health department's capacity for critical services related to infectious disease surveillance and detection, modernization of our public health infrastructure, laboratory services, addressing health equity, and emergency preparedness and response. Whereas it is critical to the lives of New Yorkers that the New York City Health Department continue taking care of New Yorkers by preventing the spread of disease, providing essential health services, and increasing life expectancy through the promotion of public health and health equity initiatives.
And I'll pass to Lisa to share more about the actions.
Honored. Now, therefore, it is resolved that the New York City Board of Health affirms the responsibility of the New York City Health Department to protect and promote the health of all New Yorkers, regardless of who they are, where they're from, and where they live, and reaffirms the department's commitment to its values of accountability, compassion, equity, excellence, integrity, rigor, and transparency. Commends the staff of the New York City Health Department for their honorable and expert service in pursuit of the department's mission, upholding city charter, health code, and other legal mandates, as well as their commitment to protect and promote the health and well-being of all New Yorkers, including those most marginalized, and advance the goals of equity and access to essential public health and behavioral health services for all New Yorkers, regardless of age, race, gender, national origin, disability, income, sexual orientation, marital status, need, or neighborhood. Requires the New York City Health Department to continue its rigorous review and implementation of science-based public health guidance and recommendations to ensure the best possible public health practice in New York City, which includes directing resources to communities that will benefit most, and to continue to combat misinformation through the dissemination of evidence-based information. Affirms the expectation that the New York City Health Department will continue to engage, partner, and collaborate with city, state, regional, and national public health organizations to gather and share information, best practices, data reflecting all New Yorkers in support of public health promotion, illness prevention, population health and wellness for New Yorkers, to advance public health and behavioral health science, and to respond to health emergencies. Affirms the commitment of the New York City Health Department to monitor and assess the impact of policy, program, and budget changes on department operations, public health staffing levels, and other changes to essential public health and behavioral health services that would impair the ability of the New York City Health Department to keep New Yorkers healthy and/or perform its essential public health and behavioral health functions. and report potential remedies to the New York City Board of Health. Affirms the role of duly elected and appointed officials to act to prevent harmful federal, state, or local legislative, regulatory, and programmatic mandates, public health staffing reductions, and other harmful changes to essential public health and behavioral health services that would impair the ability of the New York City Health Department to keep New Yorkers healthy. And affirms the commitment of the New York City Board of Health to uphold the public health and behavioral health provisions of the New York City Charter and Health Code, review proposals and adopt changes in the New York City Health Code to promote health, public health, and safety, monitor the impact of proposed changes in legislation, regulations, policy, program, staffing, and/or budgets, issue public statements, and engage the Department of Health and otherwise take action to maintain the health and well-being of New Yorkers.
Thank you. So our charge is difficult but clear. We can move to the next slide. We have a few minutes for board discussion on the proposed statement. Open it up to comments, suggestions, or questions from board members. Would encourage those comments be less oriented towards wordsmithing and more towards any particular comments you might have about content or otherwise. Please.
Thank you for laying out so clearly the role of the health department in protecting the health and well-being of New Yorkers and in clarifying what the Board of Health's role is. I do have one question. I think you said earlier that there were 20,000 people who were cut from HHS. The document says 10,000. I'm sorry to nitpick. I know we're not wordsmithing, but if there's a different number, we should just make it accurate.
Thank you. Yes, appreciate that, Gail. The 10,000 is the reduction in force.
I got it.
And then there were another 10,000 who voluntarily
I see.
retired.
Got it. Okay. Thank you.
Any other comments from board members? Okay, all right, so we are asking the board to adopt this statement regarding the department's continued work to protect public health. I'll address the board and move forward with requesting that there be a motion to adopt the prepared statement.
Motion made.
Let the record note that Dr. Kwan motioned. Could I have a second?
Second.
Let the record reflect Dr. Akista seconded. And then I'll take a vote from each member. Dr. Galvez?
Approve.
Dr. Katz?
Approve.
Dr. Lindsay?
Approve.
And Gail Nyowith.
Approve.
Thank you, board members, and I also approve. With a unanimous vote in favor of the motion, the board has adopted the statement, and thank you again for your commitment to this work. We're going to move forward. We have a few more agenda items for the meeting today. Our next agenda item is the proposed resolution to amend Articles 3 and 11 of the New York City Health Code. Our presenter is Dr. Gretchen Van Wee again, Chief Epidemiologist, Deputy Director of the Center for Population Health and Data Science, and Assistant Commissioner of the Bureau of Vital Statistics. I'll pass it to you, Dr. Van Wee.
Thank you very much. So I'm here now with you to propose two amendments to Articles 3 and 11 of the New York City Health Code, and this is in relation to data privacy. So, in terms of data confidentiality and privacy, numerous laws and regulations in the city aim to protect our confidentiality and the privacy of information. The Health Code consists of various provisions requiring the confidentiality of information maintained by the department, which has a long history of safeguarding personal health information. And the health department seeks to continuously review these requirements through our quality improvement efforts and through our ongoing attention to all matters. We can go to the next slide, please. Based on its most recent review, the department has identified two specific provisions of the Health Code, Sections 3.25 and 1111, as warranting amendments to further strengthen the confidentiality of information and to ensure consistency within these sections of the Health Code. Section 3.25 addresses inspection of records and proceedings of the department. Section 1111 addresses the confidentiality of reports and records submitted to the department. I'll first speak to Section 3.25. Okay, we can go to the next slide, please. Okay. So section 3.25 refers to inspection of records and proceedings of the department. We are proposing revisions that would align the definition of identifying information with what we see in the administrative code. So that's section 23-1201 of the administrative code in subsection A1. Generally, this codifies current practice. This will also specify the commissioner or other authorized personnel to determine disclosure for the purposes of treatment, prevention, or care. And then finally specifies that only the minimum information determined necessary by the commissioner or their designee to accomplish the intended purpose will be disclosed. And we can go to section 1111. This section pertains to confidentiality of reports and records. The revisions proposed here are to again align the definition of identifying information with what we see in the administrative code, to really ensure that we're codifying current practice consistently across the health code, and again, specifies the commissioner or authorized personnel to determine disclosure for the purposes of treatment, prevention, and care. Now we'll just have board discussion on proposals. I'm happy to take any questions that anybody has.
Thank you, Dr. Van Wee. Any questions from board members on the amendments to Health Codes 3 and 11?
I just have a process question.
Sure.
Which is, how do you actually engage in looking through the regulations and the code to actually identify places where there might be privacy risks or need for enhanced protections?
That's a great question. We work very closely with our general counsel's office. There is a chief privacy officer here at the agency. Across the agency, all of the programs speak with him and work with him regularly. We've recently gone through a large process just to be doing this, but we're constantly looking at our code, and Lisa can comment more on this, but we're really constantly looking with a total quality improvement perspective to see how we can do things better.
Thank you.
I don't have anything to add. I think that was exactly right. But it is a constant sort of concern of ours during any period of time of making sure that our confidentiality is the strongest it can be.
Awesome. Thank you.
You're welcome. Okay, I'd like to ask the board to approve for publication for public comment the proposed amendments to section 3.25 and section 1111 of the health code.
I do have a question, Gretchen. It may not pertain to this exactly, but it's pertains to our earlier thing. What we're doing here is being sure that the department's records can't easily be obtained, especially about confidential information. The one problem is that potentially a subpoena would get the information. You can't defend against that unless you don't collect the information. If you don't collect information, it doesn't matter if somebody has a subpoena, right? So the specific example for us is we don't collect in health and hospitals, we don't collect immigration information. So if you sent us a subpoena demanding the immigration status of our patients, we can't help you.
Right.
We don't have it. We could have it,
Right.
but we don't have it.
Correct, yeah.
So how do you think about that in terms of us? Are there things that we're currently collecting that we might want to stop collecting, which is again a slightly different issue than this, which is about making sure that we're not disclosing things that we have?
Thank you for asking that question, Dr. Katz. This is something that we have been spending a lot of time thinking about. And stopping collecting is always a tool in our toolbox. We're very careful in general not to ask about immigration status. We really let the purpose of what we're trying to achieve guide what we're doing, and broadly, the first thing is to protect and promote the safety and the health of New Yorkers. So we are engaging in a process to take a more fine-tooth comb to look at all the data we share external to the agency. And I'd be happy to come back and talk more about that. But in short, we have about 138 instances where we do share external to the agency with some governmental institution, whether it's at the federal level or the state level or other jurisdiction. And we're looking at it at fine tooth comb. And stopping collecting is a tool we have talked about at length, and there are a lot of other confidentiality protections that you can put in place to protect data. So things like, instead of giving date of birth, giving the month and year of birth, like there's a whole body of work also around confidentiality of data that we're doing, that we have been doing at the health department. Yeah, thanks for the question.
Any
If I
other
may ask,
questions?
what is
Yeah.
the most common reason that you've seen for requests for release of information?
Well, there's so many requests for release of information, and they all vary depending on the different purpose. So for example, and often we generally, as I mentioned, we really do, this is codifying current practice. We generally are trying to say, we're going to release aggregate data that's aggregated, so you can't identify somebody. So for something like a purpose of trying to understand the health of the New York City population, or you can achieve that with aggregate data. If you're trying to control an outbreak, and you will have to have more fine level data, you need to have, more personal information. So it really, so the answer to the question is sort of like, it depends, but really it's all those things that are supporting our mission to protect and promote the health of New Yorkers. And whatever is necessary at the time to do that.
And one thing I'll add, Dr. Akista, because we have so many of our data sets publicly available, we have a tool called EpiQuery on our website. So that kind of tool allows researchers to directly access our data without necessarily making a special request to us. So that's kind of one of the ways that we try to streamline the data access process, particularly for data that's aggregate and not identifiable.
And I would just add one more, piece to answer your question, Dr. Akista, and that is that vital records actually is probably one of the most asked for pieces of information, death certificates, birth certificates, and
Yes.
and Gretchen heads up that piece of work as well.
So excuse my ignorance, but who most frequently makes these requests?
Sure. So we're part of so like in the example of the vital statistics system and the disease surveillance work we do, we work closely with CDC. So CDC, the federal government, is our #1 federal customer, federal partner. And this is why the work that the federal government does around public health is so important, and sort of so critical. So they are really the #1 partner, but then we also share data that's de-identified for a lot of other purposes. For the state, we share with the state, of course, but we also share with researchers. We do actually a lot of fraud prevention work on the birth and death certificate part as well. We work with the Social Security Administration. When children are born, when they register their birth at the hospital, there's a checkbox on a form they fill out. And if that checkbox is completed, we send the information about that child to SSA so they can get a Social Security card. So there's lots of different things. There's a whole fabric, there's a whole ecosystem around data that we're really looking at.
Thank you.
Any other questions from board members? Okay, thank you. So we'll vote on the proposed health code amendments. Could I have a motion to approve for publication and comment the proposed amendments to Articles 3 and 11 of the New York City Health Code?
Motion to approve?
Let the record reflect that Dr. Akista has motioned first. Could I have a second?
Second.
Let the record reflect that Dr. Lindsay has motioned second. I'll take a vote from each member. Dr. Galvez?
Approve.
Dr. Katz?
Yes, approved.
Dr. Kwan?
Approve.
And Gail Nyworth?
Approved.
Okay, so with a unanimous vote, 6 out of 6 in favor of the motion carries. Thank you, Dr. Van Lee. Next up, we have on our agenda, the proposed notice of adoption to amend Article 141, Water Supply Safety Standards of the New York City Health Code. Our presenter is Diane Fung, Assistant Commissioner of the Bureau of Environmental Services and Engineering. I'll pass it to you, Ms. Fung.
Thank you. Good morning. I'm presenting to request the adoption of amendments to Health Code's Article 141 and 175 that were previously proposed at the last meeting in March. The first is for Article 141, which is our water supply safety standards. Specifically, we had proposed to amend Section 141.11 of that article, which applies to adding chemicals or other substances to water. This typically happens within a building's footprint where water treatment is added to the building's internal plumbing system. We regulate the entities that perform that type of work and that treatment. There are currently 17 adding water to chemicals permit holders, and they operate in about 380 buildings in New York City. Our proposal was to modify, sorry, next slide. Oh, no, it's in there, sorry, back. Our proposal was to modify record-keeping requirements for permittees installing and operating these systems. For installation, the reporting time frame would extend from 24 hours to 5 days or upon request, and reporting the start or end of treatment remains the same, which is within 24 hours. Permit holders must also report specific information in the manner we specify. That's currently in an electronic form that we provide. Next slide. The board approved publication of the proposed amendments in our last meeting on March 19th. The public hearing was held on May 6th, and there were 3 written comments. They were all supportive of the changes. Two out of the 3 comments included recommendations that are beyond the scope of the proposed changes. They were related to public access, to water quality data, community engagement, and climate resilience planning. So after receiving those comments, no changes were made to the proposed rule. Next slide. We are asking the board to adopt amendments to Health Code Section 141.11 to update reporting requirements for the adding chemicals to water permit holders.
Thank you, Ms. Fung. At this time, we'll take questions from the board on these amendments, the Health Code Article 141. Are there any questions or comments from board members?
No.
Okay.
I have a question. Again, what kind of chemicals are used to treat our water?
There's 3 approved uses for the adding chemicals. It's either for disinfection, corrosion control, or scaling control. So it's usually within an internal plumbing system, either to disinfect for a bacteria or any other bacteria that they see in their system, or it's to preventative for corrosion and scaling control.
What kind of chemicals are used to treat the water?
For disinfection, it's usually chlorine residuals, types of chlorine additives, and for corrosion, it's usually some silica treatment to prevent corrosion.
And these are specific to 17 providers in 380 buildings. It's not system-wide in the citywide water supply.
Correct.
Thank you.
Any other questions from board members? If not, okay, we'll vote on the proposed Health Code amendments. Could I have a motion to adopt the proposed amendments to Article 141, Water Supply Safety Standards of the New York City Health Code? Let the record reflect that Gail has motioned first. Could I have a second?
Second.
Let the record reflect that Dr. Galvez has seconded, and I'll take a vote from each member. Dr. Akista?
I approve.
Dr. Katz?
Approve.
Dr. Kwan?
Approve.
And Dr. Lindsay? Okay, so with a unanimous vote of 6 out of 6 members in favor of the motion carries. Thank you, Ms. Fung. And you are also presenting our next agenda item on the notice of adoption to amend Article 175, control of the New York City Health Code.
Yeah, so our second request is to adopt amendments to Article 175, which is for radiation control. Our proposal is to amend the code to conform to applicable federal regulations. Article 175 lists certain provisions of Title 10 of the Code of Federal Regulations that are explicitly not incorporated by reference. The U.S. Nuclear Regulatory Commission requested a change to that list. Specifically, Article 175-101, or Section 175-101B, would be amended to remove the exclusion for 10 CFR Sections 1911 C and D, and those apply to worker notifications. Once removed, these federal provisions will be incorporated by reference. Secondly, we would amend 175, 103C by removing the exclusions for 10 CFR sections 30.36D through K that apply to license terminations and site decommissioning. Once removed, these 8 federal provisions will also be incorporated by reference. Next slide. The Board of Health approved publication of the proposed rules in our last meeting on March 19th, and the public hearing was held on May 6th. We did not receive any comments, and no changes were made to the proposed rule. Next slide. We are asking the board to adopt amendments to Health Code Article 175.
Thank you, Ms. Fung. Any questions from board members about this amendment? Okay, hearing none. Could I have a motion to adopt the proposed amendments to Article 175? I'll let the record reflect that Dr. Lindsay has motioned first. Could I have a second?
Second.
The record reflect Dr. Katz has seconded. I'll take a vote from each member. Dr. Galvez?
Approve.
Dr. Kwan?
Approve.
Gail Nyworth?
Approve.
Approved.
Okay, so with a unanimous vote in favor, the motion carries. Thank you again, Ms. Fung. Gail. Our last agenda item for our meeting today is the proposed notice of adoption to amend multiple articles of the New York City Health Code in relation to modification of such articles and/or sections. Our presenter is Jean-Baptiste Ruda-Siqueira, Executive Director of Environmental Health Legal within the Bureau of Environmental Surveillance and Policy. I'll pass it to you.
Thank you. Good morning, everyone.
Good morning.
I'm going to propose the adoption of changes to modification provisions in the Health Code. As a reminder, the department has authority to modify the application of certain provisions of the Health Code in a specific instance in response to a request due to practical difficulties complying with a particular requirement. There are almost 20 modification provisions in the Health Code. Currently, modification provisions have different language, likely due to inconsistent drafting over time. Some require a showing of practical difficulties or undue or unusual reasonable hardships. Others just unusual but not unreasonable hardships. Additionally, excuse me, some modification provisions expressly require the health commissioner to make a determination rather than allow a designee. And a small portion of the modification provisions allow the requester to appeal a denial to the Board of Health, which is not required by law or necessary. Modification requests can be granted in a specific instance if the purpose of the health provision can be satisfied. The proposal will standardize the modification provisions and ensure consistency going forward. Here's the standard language that we propose to be amended into all modification provisions in the Health Code. As you can see, the standard to request modification provision is practical difficulties. The commissioner or designee can grant a modification request, and it's clear failure to comply with the terms of modifications can result in enforcement action. And lastly, the denial of a request is deemed a final agency determination. As for the rulemaking process, on March 19, the board approved publication, which was done on March 31st. We had a hearing on April 30th. We received 2 written comments objecting to replacing the undue, unusual hardships with practical difficulties. Both commenters expressed a concern about generating endless administrative headaches for the public. However, the department's implementation of the practical difficulties standard will continue to ensure the issuance modification only when the circumstances warrant one. The modified application meets the same public health purpose as the Health Code provision. Accordingly, we did not make the requested change. So at this time, we're asking the board to adopt the amendments of the modification provision across the Health Code.
Very much. Are there any questions or comments from board members? Okay, so hearing no questions, we'll vote on the proposed Health Code amendments. Could I have a motion to adopt the proposed amendments to amend multiple articles of the New York City Health Code in relation to modification of such articles and/or sections?
So moved.
Let the record reflect that Gail Nyworth has motioned first. Could I have a second?
Second.
Let the record reflect that Dr. Kwan is seconded. I'll ask each member for a vote. Dr. Akista?
I approve.
Dr. Galvez?
Approve.
Dr. Katz?
I approve.
Dr. Lindsay?
Approve.
Okay, thank you all. And with unanimous votes in favor, the motion passes. Thank you, everyone, for attending today. Thank you, Board of Health members. The meeting is now adjourned.
Thank you.
All right, thank you.
Nice to see you.